My name is Katinka Blackford Newman. I am not a medic, and I knew nothing about antidepressants until I had my own experience with antidepressants in 2012.
Can you talk us through, if there is a patient in front of somebody or a colleague in front of somebody, how would you recognise this? What does it look like?
When people are having an adverse reaction, their body is going into toxicity. So one of the main symptoms of this is a movement disorder called akathisia, which in Greek, it means inability to sit still. When I had it, I couldn't sit still. I was walking round and round the room, and I would be like this all the time. And I just was very fidgety. It's like being in hell. And it's one of the main drivers that causes people who have had no history of mental illness to just want to end their lives because it is so agonizing. It can cause people with no history of mental illness. They've never felt suicidal before to feel suicidal as a result of the chemical effect of these pills, as a result of their body going into toxicity. And of course, there's also a narrative which is that these pills take a while to work, and so you might feel worse before you feel better. That's a shame if it's missing this side effect. People can feel suicidal because they want to end the pain, the physical pain. The most dangerous times for this is when people go on an antidepressant, change dose, or come off an antidepressant.
Is it always associated with the akathisia, or can the suicidal ideation be a side effect of its own right?
You have serotonin syndrome, and that is characterized by a temperature, often delirium, an inability to regulate your temperature. So you go from very hot to very cold. And that is one of the other mechanisms whereby people there's an altered sense of reality, the emotional blunting that can be helpful for some people when antidepressants work well. We know that one of the ways that they help people is that they can blunt people's emotions, and that can be very helpful for some people. But when people are suffering an adverse reaction, it is like that is amplified to such an extent that people don't quite understand what they're doing. So it's almost like they don't really quite realize the consequences of actually ending their life or self-harming or whatever.
So if you have one message to finish off today, what would you want GPs listening, nurses listening to think about or remind them of?
If you can inform your patients of what an adverse reaction looks like, you will be saving lives. The drug company data is that 1 in 100 people suffer suicidal ideation as a result of these drugs. I think that's a conservative estimate, but even so, there are 8.5 million people on antidepressants. So even if their data is accurate, that is a large number of people whose lives are at risk. My message is to please inform people that they can suffer an adverse reaction within hours of taking the pills.
And every country has an ambition to reduce suicide. We understand why the role antidepressants play in that, but it is counterintuitive for so many people to consider. But in that good intention can sometimes backfire, and we can no longer ignore this.